Well, the U.S. is battling a COVID surge, mostly fueled by the Delta variant. At least 42 states are reporting an increase in hospitalizations in the past week, and the number of new cases has risen almost 16% across the country. Most of the people suffering serious symptoms are unvaccinated. Nikki Batiste reports from one Pennsylvania medical center under strain.
There's a lot of hoops to jump through just to fight for your life.
Caitlin Lilly's brother, Kyle Whiting, was unvaccinated when he contracted COVID in October. He's been hospitalized ever since.
Do you think that had Kyle been vaccinated, he'd be in a different position today?
I think it would have helped him medically. I think it wouldn't have been as bad, but I couldn't say for sure if it would have prevented all this.
So far, Whiting has spent his 27th birthday on life support and has even missed his wedding. His lungs are no longer functioning, and he now needs a double transplant, an operation that was delayed by a week as he waited for an open bed in a Philadelphia hospital.
He's never going to have the same life he had.
Nationwide, cases are increasing, overwhelming many hospitals. Geisinger Wyoming Valley Medical Center in Wilkes-Barre is operating at about 120% capacity, with nearly a quarter of patients in the COVID unit.
It feels like the outside world has sort of said, well, the pandemic is behind us. And then I go to work and it's very much not.
Emergency room physician Dr. Essie Reed says most of the patients she sees are unvaccinated.
The saddest thing is when they're asking when they can get the vaccine, and you're just not sure if they're going to make it to that point.
Dr. Stella Safo joins us now. She's an internal medicine physician and the founder and CEO of Just Equity for Health. Thanks so much for joining us. So let us talk about, some of what we saw in Nikki Batiste's story there from Pennsylvania. Hospital systems are currently overwhelmed. I think people don't quite understand that when a hospital is overwhelmed with COVID patients, it just doesn't affect the type of treatment the COVID patients are getting. It affects the type of treatment everyone who needs to go to the hospital is getting. Can you talk about the dangers that this places on the U.S. healthcare system when we have these overwhelmed facilities?
Absolutely. It's a danger both from a resource perspective of having enough beds. An ICU bed is very specialized. It has to have a certain nursing and staff ratio to patient ratio, as do hospital beds as well. And so it's just about having the space to get people onto the floors. This is why you're seeing, emergency room times and waiting times of up to half a day, if not more, for people to just get admitted to the hospital, to the right facilities that they need. And then there's also the reality that we've been in this pandemic going into 2 years. So the people who are providing the care are burned out, they're tired, people are leaving medicine, and so the workforce is also slowly becoming under-resourced as well. So you're dealing with both a resource from an infrastructure perspective being low, as well as individuals that would actually be taking care of you also being lower than we would like to see it at this point with the numbers that we're seeing.
Yeah, and of course the challenge, doctor, as you know, is that although there are some 200 million plus Americans who have been fully vaccinated against the coronavirus, there are still many millions of others who have not, which has of course led to the rise of these variants hospitalizing folks and putting the strains on our hospitals, as you just indicated. And we have seen that the focus has been of late, specifically in the media and in other places, on this Omicron variant. But at the moment, it is still Delta that is leading the COVID-19 surge in cases and hospitalizations. I mean, give us a sense of that. Is it simply because we still don't have everyone or the majority the majority of people perhaps have been vaccinated, but not everyone in the United States has been vaccinated. And that is causing these variants to bounce around between vaccinated and unvaccinated folks, which then causes hospitalizations.
That's absolutely right. A patient of mine expressed frustration because they had gotten vaccinated early on when vaccines were ready. And they said, I'm vaccinated, but I feel like it doesn't matter. We're still dealing with the same pandemic. And I wanted to remind them that some of us being vaccinated is so incredibly helpful, because it means that when you get sick, your chances of being very sick and ending up in the hospital and requiring an ICU bed are much lower than if you're not vaccinated. So if you are a vaccinated person and you're feeling frustrated that this pandemic is still running rampant, know that you yourself have individual protection from being vaccinated. I will say that you're absolutely right that Delta is still the thing that we are most dealing with in terms of the variant of COVID. Omicron has only one good thing that it's done, which I've seen in my clinic as well, which is that it's pushing people to get boosted, and it's pushing people who haven't been vaccinated yet to go ahead and get vaccinated. We will see in the coming weeks how much it takes over, whether it takes over from Delta, whether it's more severe. Early cases are showing that maybe it isn't as severe, but it almost doesn't matter, because if the numbers are really high and more people are infected, we're going to see more people ending up in the emergency room and in the ICU, and most of those will be folks who are unvaccinated. So the message here is we needed to vaccinate not just everyone in the U.S., but really everyone in the world. We're at the point where COVID will not stop until we vaccinated the world, and that is what a lot of us are really focusing on now.
You know, Doctor, as Vlad pointed out, 64% of the eligible population is fully vaccinated in this country. That's good, but it's not everyone. I'm curious about, what your patients are telling you who are still not vaccinated. What you just said about that one patient and getting a booster shot or not, I thought was really interesting, because I can understand why there could be vaccine fatigue at this point, because it seems like we're just getting more information and it's not, and some of the information is speculative, but it's delivered like it's like another instruction that might be coming for us in the future. But for the patients that you have that still aren't vaccinated, I mean, what are they saying to you? Why are they holding off? What's going on at this point?
I will say that the misinformation and the disinformation campaigns that are just rampant have really convinced some individuals that the vaccine is worse than COVID. Those individuals we will keep talking to, we will keep counseling, we will keep answering their questions. I don't know how much it will change their minds to get the vaccine. However, we have to stop acting as though the vaccine is the only thing that we have to stop COVID. We know other things work. We know masking works. We know social distancing works. We know not getting together in a crowd works. And so one thing that I have found for those patients of mine who are stalwart and knowing that they do not want the vaccine is I'll just talk to them about, so what are you doing to mitigate your risk? What are you doing to keep yourself safe? And a lot of folks that I'm seeing, at least, and maybe they're just telling me this because I'm their doctor, they'll say, look, doc, I'm not going to get the vaccine, but I promise you I'm wearing my mask. Or I'm not going to get the vaccine, but I'm being careful otherwise. And I just really want to emphasize that, because is it the best thing to get the vaccine? Absolutely. But if you're not going to get the vaccine, you should be even more vigilant in doing the other things that we know that work that can keep you safe.
But doctor, so to that point about folks who decide that they don't want to get the vaccine, and we're not talking about people who are claiming exemption for religious reasons or for health reasons, the people who legitimately just don't want to get it because they feel like that it's something that they're being forced to do. Doesn't that mean that as long as there are significant numbers of unvaccinated people in this country, local and state governments and even the federal government will continue to impose public health measures to ensure that the vaccines and the variants, the virus and the variants that come after the ones that we're already dealing with don't run amok? I mean, it's kind of like a chicken and an egg thing, right? There are people who say, well, I don't want to get the vaccine, but I hate all these public health measures. I hate having to wear a mask on an airplane. I hate having to wear a mask in a restaurant. I hate my kids having to wear it, but you won't get vaccinated. And so if, you know what I'm saying? It's like, it's kind of it's a struggle for, I guess, people like you who are on the front lines to try to explain to folks that that's the reason why these measures are in place. If everyone was vaccinated, you presumably would see a relaxing of these public health measures.
That is exactly right. It's like none of us can have nice things until we can all act right. And it is incredibly frustrating. The reality of the matter is that I think these individuals who are very resistant will be convinced at some point. It's unfortunate that some of the convincing will happen when they watch a loved one suffer from COVID, an unvaccinated loved one suffer from COVID, or they themselves get COVID and have a bad, impact. I'm hearing a lot of people who said, look, doc, I wasn't going to get vaccinated, but then my cousin got COVID and it was really bad for them. And now, I guess I'll get it. So just time will kind of take us through and time will tell. And also the reality of the matter is that some of these mandates do work. There are people who, they say, look, I want to keep my job, so I'll go ahead and get vaccinated. But you're absolutely right that if we could all kind of be in this together and do the protective measures, do what we needed to do to really keep all of ourselves and each other safe, this pandemic could be controlled. I want to emphasize, though, that whatever we do in the U.S. is going to be excellent to keep us safe here, but we don't have closed borders. And so it matters what the rest of the world does as well. And with some countries having less than 10% of folks vaccinated, we're still going to have this cycle where COVID can be spreading and mutating in other areas and then coming here and getting people sick. And so we have to think about our solution as being one that's really broad.
Yeah, and I should point out, Dr. And Anne-Marie knows this too, that what we've seen as far as success in convincing people to get the vaccines is not public shaming, it's not condescension to people who refuse to get the vaccine. It's sitting down and having conversations. If those conversations take an hour or if they take a week, eventually, once people feel as if all of their questions have been legitimately answered and the stench of politics is removed from those discussions. I mean, I've seen it. For example, I interviewed Lane Kiffin, the head coach of University of Mississippi football team. Mississippi is one of those states that has very low vaccination rates. He was able to, after weeks of discussions with his players, with the staff, with the coaches, everyone at the University of Mississippi football program has been fully vaccinated against the coronavirus. And Coach told me that there were a lot of people who were resistant, but every time they had questions, they brought in doctors, they brought in nurses to talk to them, and eventually everyone saw the light at the end of the tunnel and chose to get those vaccines. So it does seem that that is the best way to do it. I get that people don't want to hear from on high, whether it's the president of the United States or a governor, finger wagging at them to say, here's why you need to be vaccinated.
That's exactly right. Empathy really is the way going forward. And all of us are out of patience. All of us are tired. If we never said the word COVID again in our lives, it'd be too soon. But unfortunately, we are all in this together. And so we will get there by really guiding and being there for each other as we figure out how we're all going to make it through the pandemic.
Dr. Stella Safo, thank you very much. Have a wonderful weekend. Appreciate it.
You too.